Hi, this is Chris from OrthoWell Physical Therapy. I'd like to expand upon the post that I just did on stretching. Essentially the post talked about was the fact that stretching, the effects of stretching aren't as long lasting as we'd like them or would hope that they would be. That the effects of stretching are more transient. So one day you might feel like you've stretched and it feels nice and loose, and then the next day you stretch and it feels like you've never stretched before in your life. It could be totally different. There's this whole idea of sensory theory that's out there now. This idea that by stretching, the reason why people get an increase in range of motion is that the amount of stretch pain that they feel is less. It's not because of a mechanical elongation necessarily of the tissue, although the research says that there is a certain amount, okay? But most of the research now is looking towards this idea of the stretching analgesia, okay, where you have a little bit of a less pain when you're stretching, which makes you feel as though you're stretching further. Okay. Gray Cook has really brought into into the light this idea of motor control, this lack of muscle activity, or this lack of muscle activation as you're performing certain things during the day. So as a result of that, you feel stiff. Okay. So the stiffness isn't necessarily a result of shortening of tissue. It's a result of muscles that are firing and become active because your body can't control a certain maneuver or a certain motion. We'll take the hamstrings, for example. If you're someone who stands all day long, you're behind a cashier or you're on the line, automotive plant or something, and you're standing, you're not engaging your core, and your pelvis rotates anteriorly. What that does, it actually activates your hamstrings because your hamstrings need to fire in order to try to rebalance the system. Our lumbar spines tend to be too mobile. Okay, so your hamstrings are attempting to create more stability in the lumbar spine region by contracting and firing. Okay, so this idea of increases of hamstring stiffness ensue because of this lack of motor control in your lumbar spine. Okay, so if you're somebody who's been doing this for years, okay, this idea of, well, what should I do? Should I stretch my muscles? And Chris is telling me it's a lack of motor control, what should I do? Okay, so if it's been 20 years, I mean, you've got this constant state of anterior tilt, your hamstrings firing to guard and protect your lumbar spine. Is it wrong to be stretching them? Not necessarily, because as a result of being in that constant state of contraction, standing 8 hours to 10 hours a day, your muscles can develop scar tissue, okay? Can develop, trigger points. Lactic acid builds up in the muscles. So grabbing a massager stick or a foam roll, putting your foot up on something and working that tissue, there's nothing wrong with that. That same idea of sensory theory. You're trying to override pain receptors. You're trying to desensitize. You're trying to bring circulation in there. You're trying to work out the waste products in that tissue. There's nothing wrong with that. And the idea of stretching afterwards too, on the right biomechanical stretch, where you're putting your foot up on a stool or a table, your foot you're standing on is pointing straight ahead. You're rotating your pelvis anteriorly to take up the slack and pre-stretch the hamstrings before you actually lean forward. You're doing a proper biomechanical stretch, okay? So yes, the effects of stretching are transient, but there's been no real substantial long-term studies that look at longer duration stretches. And this is a thing I mentioned in the post as well. If you stretched for 20 minutes, that hamstring every single day of the week, they've shown that there is an increase in elongation of the tissue. But who's got time to stretch for 20 minutes every day? So we're kind of our own worst enemies when it comes to this idea of we're not getting elongation of tissue because we're just not stretching long enough. Okay, so this is something else to consider. It's not just one thing, it's the combination of things. And at OrthoWell, we want to make sure you understand the combination of working your self-massaging tissue, of stretching tissue, and of course, encouraging motor control. So when it comes down to even simple tests that we do in the clinic to ascertain whether it's a motor control issue or if it's a flexibility issue, is just simply sometimes a standing forward bend test, okay, a toe touch test, where you tell people to keep their knees straight, you bend down, and you try to touch their toes. Some people, it's maybe mid-shin, they can't even get down. A way to increase motor control, or to enhance the motor control aspect, is to take a foam roll and to place it between your thighs, okay, squeeze as hard as you can, and then bend forward again. And in probably 9% of the cases, 9 out of 10 people, that range will increase. You can start to add maybe lifting your heels up on a 2x4, in combination with this, or putting a 2x4 underneath their toes to decrease the amount of pronation that occurs with this. So there's different ways that we can utilize these maneuvers to actually encourage an improvement in motor control. Okay. When it comes down to squatting, most people, if they haven't been trained properly, don't squat the right way. Okay. So you can take a stick, put it behind somebody's back, against the head, against the low back. When you go to squat, you have to hip hinge, get your butt out as much as you can, bend forward, knees never go past your toes, feet stay flat on the floor. And then there's ways to improve someone's motor control with squatting. Okay, so we're really trying to enhance as much as we can the effects of motor control, okay, with the forward bending test, with the squatting test, and then what kinds of corrective exercises can we perform to improve these things. And that's the stuff that we'll certainly get into when you come to see us at OrthoWell. We'll talk about all of these components. There's a lot of stuff online about functional movement screens and great cook stuff. Just be open-minded when it comes to how you approach these things, because most oftentimes it's multifaceted. So come and see us, we'll take a look, and we'll go from there. We'll see